All right, up next we have Lori Casselman, who is the President and Chief Revenue Officer of Wello Virtual Healthcare. And tonight, Lori is speaking about the present of work. Welcome, Lori.
So pleased to be part of the session tonight. First thing I would really just love to take a moment to touch on is really the topic of racial equality. And first of all, I really just want to thank Maggie and the TechTO team for creating an opportunity and space in tonight's session for us to speak to this very important topic. You know, I think that really is the first and foremost most important thing that we are doing as global business leaders and as a business community is putting more attention on and focus to this very important topic and really the very important actions that we need to be taking. So in terms of what's happening within our organization, I would say like many other organizations across the Canadian business community, we have a very strong diversity and inclusion principles and policies within our organization. But what has really sort of risen to the forefront for us over the last few weeks is the fact that the dialogue and conversation that we need to be having has been somewhat lacking. And so we've really put a much stronger focus on having that dialogue internally. There's strengthened awareness within our organization of the important work that needs to be done. And when I say the work that needs to be done, it is really going beyond policies and practices and taking concrete actions. And one particular concrete action that we have really put some focus on in terms of our diversity and inclusion belonging strategy is thinking about our hiring practices. And, you know, I'd say most importantly in our hiring practices, putting a stronger focus on hiring people of color, and in particular, Black Canadians, to leadership and board positions within our organization. And so I do think it's important that we are being very specific and very, directive and concrete in the actions that we're taking. And so with that, again, I just want to thank Maggie for using this platform today to create an opportunity for this important conversation. So just to level set in terms of the lens that we bring to the conversation tonight, Wello is a virtual care platform. We are a B2B offering, so we liaise with HR leaders and employers and offer virtual care services to employees within workplace settings as part of the employee benefits offering. So in terms of our model, we integrate with the healthcare ecosystem. So really, we are a very complementary service for those employees. So there is certainly no intention to replace the family physician or the caregiver complement that the employee is accessing today. We are a complementary coordination of care, support, and service. And I would say never has that been more important than in the last few months with COVID-19. So if you think about this from the employer's perspective, COVID-19 significantly altered the employment proposition virtually overnight. So employers and specifically HR leaders within organizations were really, rallying quickly to manage remote office scenarios, really support social distancing when they had employees who were frontline or mandatory workers who needed to be sort of staying within their physical work environment and providing core services. In many cases, they were trying to run businesses with travel limitations and managing heightened fear and anxiety for many employees within their organizations, all while trying to maintain an element of productivity within the organization and keep employees engaged and connected. Now, when we look at some of the data points from the last few months as it relates to how the challenges of the pandemic have shown up for Canadian employees, some of the data points that I think are very relevant. So 85% of Canadians who have access to employee benefits have indicated now they want and are looking for virtual healthcare as part of their employee benefits package or offering, which is a dramatic increase over the last few months. 49%, so close to half of the Canadian population, working population, are reporting that the pandemic is having negative effects on their physical health. And when we look at mental health, those numbers are significantly greater. So 60% of Canadians are indicating that they developed mental health concerns, largely in the categories of anxiety and depression during this pandemic period. And some experts are now indicating that the next great pandemic, when we work our way through this particular scenario with COVID-19, is likely to be a much enhanced mental health crisis. And so if you think about that from the employer's perspective, there's a significantly heightened priority on the importance of really strong and significant and comprehensive mental health strategies to support employees. So a very strong and meaningful shift occurred to the employee benefits landscape over the last few months. Businesses really have adapted and listened. So what we're seeing is employers offering home office subsidies, really supporting employees to set up that remote home office space. Also really thinking about communication and employee engagement strategies. We've seen wonderful tools being employed, beyond the virtual platforms that we're all using to manage our day-to-day meeting scenarios, all kinds of great tools and practices around communication, connection, and engagement for working populations. We also saw a significant adoption of technology for health support. So over the last couple of months, so there's various data points or schools of thought in terms of, what the adoption rates have been for virtual healthcare benefits. But effectively, if you go back to early January, February, about 9% of employee benefits plans had virtual health or telemedicine support as part of that package. Some statistics or reports are now indicating we're closer to 22. Others are predicting we're closer to 35%. So there was marked shift in terms of the amount of solutions being made available. The number of partnership announcements with virtual care providers and employee benefit services was absolutely phenomenal over the last few months. We also saw a significant increase in well-being strategies. So the offerings, things like Headspace, Calm, apps to manage resilience and mindfulness and meditation, all kinds of great virtual care solutions to support remote physical activity. And now we are seeing, as I mentioned, an enhanced focus on mental health supports and a lot of great solutions being put in place for employees that are virtual in nature as well.